Hello and welcome to our presentation today. My name is Casey Setsodi. I'm with HealthPartners, UnityPoint Health, and I will be guiding you through our sales presentation today as we introduce and discuss the Medicare Advantage plans that are available from HealthPartners UnityPoint Health. After I introduce HealthPartners UnityPoint Health and explain some background on Medicare, we'll spend most of today looking at your plan options. While we go through today's presentation, I will address the questions that you currently see on the slide. So let's start by talking about HealthPartners UnityPoint Health. At HealthPartners UnityPoint Health, we will work together to make the best decisions for your health with both care and cost in mind. And here's how. We offer personalized care, a partnership between our doctors and insurance team means better, more affordable health outcomes. You'll have a single team. Getting your health care and insurance coverage from one place makes managing your health simple, and track records you can trust. HealthPartners UnityPoint Health is a partnership between two organizations with a history of great results. UnityPoint Health, as you likely know, is an Iowa nonprofit organization providing services to hospitals and healthcare providers, integrating healthcare services to patients across Iowa and in west central Illinois and southern Wisconsin. You might not be as familiar with HealthPartners. They are a Minnesota-based nonprofit organization that serves more than 1.8 million medical and dental health plan members nationwide. HealthPartners is more than just an insurance company. HealthPartners hospitals, clinics, and other healthcare facilities care for more than 1.2 million patients every year. So HealthPartners knows the importance of having your care and insurance coverage work together. So HealthPartners UnityPoint Health then is a health plan centered on you. It's the result of those two organizations that want to achieve the same thing. It brings together healthcare from UnityPoint Health and insurance from HealthPartners. The result is a company that's dedicated to keeping our patients and members healthy. We're doing it while providing a simplified healthcare experience. Now let's jump into some background about Medicare. Medicare is divided into different parts, A, B, C, and D. Original Medicare, Parts A and B, is a health insurance for people 65 and older, and anyone with certain disabilities, and also people with end-stage renal disease or permanent kidney failure requiring dialysis or a kidney transplant. The rates that you'll see on the screen are for the plan years 2021, this upcoming year. Part A is your hospital insurance. For 2021, the Part A deductible is $1,484. You pay this amount for each benefit period, which starts the day you're admitted in a hospital or skilled nursing facility and ends when you haven't received inpatient hospital care or skilled care for 60 days in a row. You have to pay this deductible for each benefit period, and you have unlimited benefit periods. After you pay this deductible, you'll pay a copay or co-insurance for covered services. Then on your screen, you'll see Medicare Part B. For 2021, the Part B deductible is $203, and most people will pay $148.50 for their Part B premium. The premiums are calculated on a sliding scale based on your adjusted gross income. This means you may pay more for your Medicare Part B if your adjusted gross income is above a certain amount filing as individual or as state. You can visit medicare.gov or medicare.gov to see the table that determines that premium. You have a lot of options for how to get your Medicare coverage. You can choose original Medicare coverage only, or choose original Medicare and enroll in a standalone Medicare prescription drug plan. However, many people choose to join a private Medicare health plan, like a Medicare Advantage plan, known as Medicare Part C, as you'll see on your screen there, or a Medicare supplement plan. Most of these can be paired with or include a Part D plan. So why do people choose Medicare Advantage plans? Here are some of the reasons we'll look at that people will choose a Medicare Advantage plan. First is savings and predictability. Medicare Advantage plans usually have lower or $0 monthly premiums compared to supplement plans, which might cost $150 to $200 a month, not including the Part D prescription drug plan that would need to go with it. And beneficiaries will be able to budget for their healthcare costs by understanding the copays, coinsurance. Second reason is simplicity. With the Medicare Advantage plan from HealthPartners, UnityPoint Health, your hospital, medical, prescription drug, and preventive dental are combined into one simple plan. And third are the extra perks. The HealthPartners, UnityPoint Health Medicare plans provide extra benefits and perks not offered by original Medicare or many supplement plans, including travel benefits, a fitness benefit, health and well-being programs, dental benefit, and vision and hearing benefit, plus personalized support, which we'll get into those details in a little bit. But first, Medicare Part D is very important to understand. Part D is available to everyone with Parts A and or B. It's not offered through the government like the Parts A and Part B are that we talked about earlier, which means that you'll have to buy it separately through a private insurance plan. Please note you can only enroll in one Part D plan at a time. Now, like with Part B, it's important to enroll in Part D as soon as you're eligible or have coverage that's at least as good as Medicare Part D, which they call credible coverage. Otherwise, you may have to pay a late enrollment penalty for as long as you have Part D. Or with the HealthPartners UnityPoint Health Medicare plan, your Part D prescription drug coverage is included in the plan. So let's examine Part D a little closer. There are 4 phases to Part D throughout the plan year. At the beginning of each plan year, you start at the deductible phase that you'll see there on the lower left. Here, if you have a deductible, you'll pay 100% for your prescriptions until you have met and satisfied that deductible. Once you reach that deductible, you move to the initial coverage phase, or phase 2. In this phase, you'll either pay a copay or coinsurance for covered medicines. Most people will spend the majority of their plan year in this phase. Now, it's important to know if you and your plan combined pay a certain amount for covered medicines, which you'll see for 2021 is $4,130. If you were to pay over that, you will move into phase 3 that they call the coverage gap. In this phase, For 2021, you'll pay 25% of the cost for both your generic and brand name drugs. Now, if your out-of-pocket costs reach a certain amount, then you move on to the catastrophic phase. So for example, money they calculate that you pay out of your pocket. So if I had a deductible, you would get credit for that. You get credit for any copay or coinsurance that you paid yourself during phase 2, and then all of the 25% costs that you paid yourself. If that total exceeds $6,550, then you move into the final phase of Part D that they call the catastrophic phase, and you pay the amounts that you'll see there on your screen. So keep in mind, you start at the first deductible phase at the beginning of each plan year, which is January 1st, no matter how much you've spent the year before. People think of January 1st as a reset button for the Part D phases and for everything you spent that previous year. One question that we get a lot is, what if I join a Part D plan during the year, say June or even October? So regardless of what month you would start your Part D, it resets for everyone that upcoming January 1st is currently on a Part D plan. Now, Extra Help is available, which is a Medicare program to help people with limited income and resources pay Medicare prescription drug costs. You qualify for Extra Help if your yearly income and resources are below a certain amount. You can contact the Social Security office to see if you qualify for this program. We sign up for Original Medicare. There are certain times when you can sign up for Original Medicare or make changes to coverage you already have. There is the initial enrollment period. If you're eligible for Medicare because you're turning 65, then your initial enrollment period begins 3 months before you turn 65, lasts until 3 months after. So that initial enrollment period will last a full 7 months for you. There's also special enrollment period. So if you didn't sign up for Parts A and or B when you were first eligible, because you were covered under your employer or spouse plan, you can sign up for Original Medicare during that special enrollment period. Most people who are getting benefits, I would add, from Social Security or the Railroad Retirement Board, will automatically be enrolled in Medicare when they turn 65. Now, these are just the most common enrollments, but there are others. You can go to the Medicare website that I provided earlier, which is medicare.gov, or refer to the Medicare and You handbook that you will receive a few months before you're going to turn 65. We'll share with you some other helpful resources for you while you're exploring your options. So regardless of where you are in your search for a Medicare plan, our educational blog is an outstanding resource. Lets you read articles on things like eligibility, Medicare basics, how to choose a plan, and a lot more. It's written by our own HealthPartners experts, so you can trust their expertise on these topics. Plus, sign up for our monthly e-newsletter to get regular resources sent right to your inbox. And of course, you can always get in touch with me with questions or reach out to our toll-free number, which I will provide later today. One of the questions we get a lot is, how is there a $0 premium? Here's how we do that. Is just remember, first, you're still paying your Part B premium. If you recall from that slide, your Part B premium for 2021 is $148.50. So you are paying the Medicare Part B premium. Medicare Advantage plans contract with the federal government to deliver benefits. The federal Medicare program pays your Medicare Advantage plan a fixed amount each month while you are a member of that plan. And second, plans use carefully chosen networks to offer high quality care at a lower cost. Networks are made up of providers who have contracted with your health plan, and typically plan members get the lowest cost for services when using network providers. And third, Medicare plans with a $0 premium really focus on making sure you get the right preventive care, because a healthier you means lower cost for you and your insurance company. Now we're going to learn about your HealthPartners UnityPoint Health Plan options. Each year, CMS, or Medicare, measures how well Medicare health plans perform. The scale that's used is known as a star rating system. Ratings range from 1 to 5 stars, with 5 being the highest score a plan can get. You may see a plan's Medicare star rating listed on plan materials or websites. For 2021, we're proud to say the HealthPartners UnityPoint Health Plans received a 4.5 out of 5-star rating. Here are some reasons why we got such a high rating. We help people get healthy and stay healthy with preventive care. We're there when you need us, for the little things and the big things, with advice, treatment, and support. And our members get outstanding service from our team of experts. Those ratings are reviewed each year, and to view the ratings, along with some more detailed information, you can go to Medicare.gov. HealthPartners UnityPoint Health offers 2 plans. One plan is called Align, the other plan is called Symmetry. And a very common misconception about the HealthPartners UnityPoint Health plans is that UnityPoint providers are the only ones in our network. And this is definitely not the case. So we offer 2 plan options that combine medical and prescription drug coverage. Our network includes all of the UnityPoint Health providers, plus others, including University of Iowa, and the rest you will see listed on the slide. For example, Stanford Health, Avera, Mary Greeley, etc. The HealthPartners UnityPoint Health service area includes the following counties in Iowa and Illinois. Now, this is the region where a health plan can be enrolled upon if you live in one of those counties. So there are 2 requirements that a person needs to meet to be able to enroll in one of the HealthPartners UnityPoint Health Medicare plans. You can join if you have Medicare Parts A and B, and you live in the service area, which the service area are the counties that you see listed there. It's not an area that is limited, that you can only see providers in those counties. For example, UnityPoint Health will have doctors' facilities in other counties, which you are fine to see treated as in-network cost. Those counties are used merely for a person to sign up for the plan, needing to be a resident. Now we're going to talk about some plan specifics. So our slide here will show us just a snapshot of the two plans offered by HealthPartners UnityPoint Health. For 2021, our premiums are unchanged with the $0 premium Align plan and the $39 a month Symmetry plan. These are PPO design plans. Under a PPO design, you have both in and out of network benefits. As we mentioned before, in addition to UnityPoint Health, there are many non-UnityPoint providers in our network. In our online directory can be found at the link you'll see in the upper left part of the screen, oneplanforme.com/find DR21. And for 2021, we have an out-of-pocket maximum of $3,900 for our Align plan and $3,600 for the Symmetry plan. What this illustrates is just the most that a member will pay for services in that given year through any combination of co-pays if you use the medical services. Also, note the $5,100 out-of-pocket maximum on the Symmetry and the $0 Align plan has an out-of-network max out-of-pocket as well of $6,500. That's a combination of cost of services if you use out-of-network and in-network both as a combined maximum. We've heard time and time again about members maybe choosing a different plan because of one specialist that was out of network. You will see that we have set copays for these out-of-network visits, which will help you get a true estimate for annual cost a member could expect. Also note that both primary care and preventive services are a $0 copay in network for both plans. And I would just mention, again, this is just a quick snapshot of our plan highlights for the medical side. When we're finished here in just a few minutes, I'm going to provide you with some contact information where you can go to request a summary of benefits, which will detail both the plans for you to view. So that was the medical benefits screen we were viewing. Now we're going to take a look at the prescription drug benefits that are included in both plans. Some of the highlights of our prescription drug plans are here. First, both the Align and Symmetry plans have a $0 deductible. If you remember, when I was describing the 4 phases of the Part D on that screen, the first phase, the deductible phase, you'll see on the left side of the screen, I have put those 4 phases on the left-hand side. So phase 1 was the deductible phase. With our plans, you actually won't have a deductible. So your prescriptions will start to have coverage right away. Means you'll go right into the initial coverage phase. You'll see we have a 5-tier system from preferred generic up to specialty, and you can see the copays associated with each. If a person prefers to use mail order, or if they are taking a lot of generic medications and want to save even more money, HealthPartners UnityPoint Health preferred cost-sharing mail order pharmacy is Welldyne RX. When you use this mail order pharmacy, you'll receive all of your Tier 1 and Tier 2 medications for a $0 copay. And you'll get great savings on Tiers 3 and 4 as well. The mail order costs you'll see are in the lightly shaded columns just to the right of the standard column. We are also participating in the Part D Senior Savings Model for 2021. Members will pay $35 for a 30-day supply of select insulins during all parts phases of Part D. Now, if you're interested in that, you want to look up some medications. Our formulary, which is an online version of the formulary, it can be found the website in the lower right corner of the screen. Very similar to the doctor directory that we talked about. It's oneplanforme.com/checkmeds21. So I've covered actually a lot of information here very quickly, just kind of giving you a snapshot or highlights of the plans. And in a few slides here, if you have some questions, again, I would recommend, feel free, contact myself. We'll have a toll-free number you can call, or visit our site online, which is the oneplanforme.com, to view more details of the two plans. Now, if you remember, one of the reasons people look at the Medicare Advantage plans are for the extra perks. We will cover these. Here is a list of the extra perks. And again, why these are important and people look to the Medicare Advantage plans is that a lot of the extra benefits and perks are not covered under original Medicare. So let's talk about personal support. As a HealthPartners member, you will get the personal support that you need to get the most from your plan. Quick advice from our team of experts. You don't have to spend time searching the web for answers. As a member, you have a personal support team as your trusted resource. There's member services for questions about your plan benefits, account balance, or finding a doctor in your network. You'll be happy to know we are a regional health plan. So our customer service is located right here in the Midwest. None of our customer service is farmed out to a third party. So you always get to call in and talk to somebody that's with our company. There's a care line service, which is staffed by our own hired and trained registered nurses. If you'd like to just talk to see if you should see a doctor, ask questions about a medicine you're taking, or learn about home treatment options, things of that nature, you'll have a nurse navigator program available. You may have questions about your health care and benefits, or need help choosing a treatment option. And then behavioral health navigators are available. If you're needing to find a mental or chemical health professional in our network in your area. With the Silver and Fit Healthy Aging and Exercise program, you can choose from a gym membership and get home fitness kits as well. Gym membership to any in-network facility at no additional cost. There are Silver and Fit signature classes, dance and yoga studios, swimming pools, and more. Members are also able to access an out-of-network fitness center, which we will reimburse 50% of the cost. You'll see a website there in the lower left of the screen. You'll go to silverandfit.com. You'll put in a zip code where you live, and you can look at the list of all the in-network facilities where we will pay your monthly membership. If you would prefer to go to a different facility that is out of network, you will still receive a benefit for this perk where we'll pay 50% of the cost. And you can choose from home fitness options as well. There are 34 home fitness kits to choose from. You get 2 free per year. And as a member, you can choose one of the 5 Stay Fit kits that we have available to you, which include a free Fitbit or a Garmin. Another health benefit that has become very important for Medicare beneficiaries is the ability to have a doctor visit without having to physically go into a doctor's office. Virtual Well is just like a doctor's visit, but online, and it's easy. If you feel you're technically challenged, don't be alarmed. It's okay. There's no need for any complicated video applications, any app that needs downloaded and set up. Not complicated at all. It's just a very convenient 24/7 online clinic where your member can get treatment for several conditions, such as a sinus infection or ear infection, and many others. The list of what they help with is growing all the time. And the best part is it's a $0 copay. Very important coverage that people want to know about with the Medicare Advantage plan is the dental. Both of our plans include a $1,000 yearly allowance for preventive and diagnostic services. So, like cleanings, exams, x-rays, fillings, simple tooth extractions, non-surgical periodontics. There's no additional cost. You can see any dentist. There is no network. See any provider you're comfortable with. There is also comprehensive dental, which would be coverage for crowns, onlays, prosthetics. At 50%. It's very simple. You simply call to request a form, complete the form, include that receipt from the dental office. You are reimbursed up to $1,000 each calendar year. Travel coverage. You get lots of travel benefits being a member of one of our plans. Medicare provides coverage with Medicare Advantage plans as follows. It is required that you only pay in-network costs for an emergency worldwide. So regardless of where your emergency is, you will always pay the in-network cost. So if your emergency is in Iowa, Minnesota, or somewhere overseas, the final cost for you is that $90 for an emergency room visit as our in-network cost. Our plans have that coverage, supplement the coverage in a couple ways. We have a visitor traveler benefit. So it lets you keep your plan while you're outside of your state of residence, anywhere in the United States, for at least 1 month at a time. You're going to pay in-network copays and co-insurance for all covered services. And you're covered for up to 9 consecutive months. We also have Assist America with some logistic help. You can visit their website, assistamerica.com, to see more details. But a brief description is it gets activated for you once you're more than 100 miles away from home, and it's worldwide. Emergency travel logistics. Very experienced company that helps people with travel, and especially overseas. Help you assess your need for medical care. They coordinate post-stabilization transportation to the nearest medical facility or your home. They have translators if you're in a country where you don't speak the language, and many other great features and benefits to help you while you travel. We have great allowances for non-Medicare covered eyewear and hearing aids. Very simple to use, the Eyewear program. It pays up to $100 for eyewear, which would include frames, lenses, contacts, and again, very simple. There's no network. So you can see any optical provider. There's a form that you can get that you simply, very simple to fill out, include the receipt, and they will mail you a check for $100 as a reimbursement. The hearing aids program is through True Hearing. The two numbers you see on the screen there are the two different copays that you may pay per hearing aid, allowing 2 per year, 1 per ear. And the copay that you will pay, the $6.99 or $9.99, based upon the technology level that you're requiring. So again, very simple program. It starts with a phone call. You receive a dedicated phone number to call in. That person will schedule your in-person hearing exam with a local provider. While you're at the provider, you'll get your audiogram and discuss all the hearing aid options. They'll determine which technology level you need. You will pay whichever copay it's determined is applicable. Your hearing aids arrive, and then it also covers the follow-up visits to get the hearing aids tuned and working appropriate for you. So as you can see, lots of extra perks and benefits being a member of one of the plans. So what are your next steps? You're going to enroll in the Medicare Part A and B. Like we talked about, you have that 7-month window. Decide which HealthPartners UnityPoint health plan is best for you. And you can do this by visiting our website, oneplanforme.com. You can call that toll-free number that you see on your screen to request another kit of information. Or if you would prefer to meet with someone face-to-face, they can also set you up with a local broker to meet in your area. And then you enroll when you become eligible. And to enroll, very simple. You can go to oneplanforme.com, compare 21. There's a nice, easy enrollment process. There's a button to click on to start the process. You can enroll over the telephone at that toll-free number. Or again, talk to a local broker that would be happy to handle that for you. If you're needing other questions answered, we can certainly arrange. Once you are enrolled, what you can expect is you'll get a welcome packet in the mail. You'll get a member ID card, where to find your coverage document, and lots of other helpful materials to help you get started on schedule and be worry-free as your plan begins. So thank you for attending today. We appreciate your time. I hope that was very helpful to you. Again, here is that toll-free number you can call to speak with someone. Request a summary of benefits. The sales kit have lots of information, specifics about the plan, or you can do it online, oneplanforme.com/compare21. Thank you again, and I hope we get to see you soon.